So coming to this diabetic foot ulcer, why there is a lot of fuss about it? Why we need to call it as a diabetic foot ulcer? Why we need to give it a designated name? Is because it is not like a regular ulcer which you have because of some injury or some thorn pick, or it's not like that. Your diabetes, which is a systemic disease, it is going to damage your skin, your blood vessels, your nerves, your bones, your joints. So each and every part of your foot is slowly getting damaged because of your long standing diabetes. So when we address all the systems at a go, so we can know what is the extent of disease in that particular tissue and treat you accordingly. So in this complex diabetic foot, the major role is played by a proper state of the diabetic foot lab. So in this lab we can assess your foot as a whole. We can do x-ray if needed and see is there an infection in the bone. We can do your doppler study, that is to see the extent of blood flow, how your blood flow is in the upper limbs and how is it in the lower limbs. Is it compromised? If it is compromised to extent, how are your sensations, how is your pain perception, are you able to feel the vibrations, are you able to differentiate between cold and hot and how cold and how hot. So when we get a detailed reporting of all the involved systems in a diabetic foot, then as a doctor I can help you in a better way. So rather than just a physical consultation where I can just do a clinical examination, my diabetic foot lab, where we can assess all these things like your shape of the foot, your skin temperature, your blood supply, your joint positioning, how are your tendons. So when I know everything in detail, so I can help you in a better way.